Good morning. Welcome and thank you for joining us for our Northern Light Health Business to Business Zoom conference. Today, we will be covering healthcare during the pandemic or the other important stuff. Topics will include primary care, pediatrics, vaccinations, and mental wellness with an eye towards prevention. I'm Dr. Ed Gilkey, the Senior Physician Executive for Northern Light Beacon Health. I'll be your moderator for the next hour. While COVID-19 has occupied much of our healthcare bandwidth, it is critically important to catch up on the rest of our healthcare needs. As clinicians, business owners, and administrators, we are positioned to remind our employees to take care of themselves in a holistic way. We know that people in Maine have fallen behind in accessing preventive care and ongoing chronic care. We have fallen behind in vaccinating children and adults. In fact, people living in Maine lead the nation in falling behind. We can do something about this. We can make accessing care safe and comfortable, and we can reinforce and encourage our employees, friends, family, and neighbors to re-engage to stay healthy. Our panelists today are Emily Chinquette, a family nurse practitioner serving patients at Northern Light Sebasticook Valley, and also Sebasticook Valley's Chief of the Medical Staff. Dr. Sheena Whitaker, a pediatrician and Senior Physician Executive at Northern Light Maine Coast. Matt Marston, Director of Northern Light Pharmacy. Angela Felicia, Manager of Healthy Life Resource Program at Northern Light Acadia. Dr. Jim Jarvis, Medical Director of Clinical Education at Northern Light Health and our COVID-19 Response Incident Commander Medical Leader. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function. I'll keep track of your questions and have our speakers respond. Also, to help us get a little more detail on how we can best support your efforts, we are going to email a 5-question survey following our Zoom conference. I encourage you to take a moment and let us know if this information is helpful and what topics you would be interested in us focusing on in the future. Let's get started. First, our panelists will share useful information from their areas of expertise, and then we will have questions and answers. First up is Emily Chinquette. Thank you for joining us. You bring a primary care perspective to the table. Help us to understand the ongoing importance of primary care during this COVID-19 pandemic. Emily?
Thank you so much, Dr. Gilkey. Thank you for inviting me today. I'm quite passionate about primary care. I've been a primary care family nurse practitioner for 20 years now, and I'm excited to share some of my experiences with you. So primary care is a very diverse specialty that makes prevention its #1 priority. The importance of primary care really hasn't diminished or changed with the COVID pandemic. If anything, the importance of primary care is even greater as patients who get COVID and have other chronic conditions seem to suffer greater complications. To that end, primary care focuses on health promotion. We really encourage people to feel empowered and take control of their own health care. We focus on disease prevention, primary prevention, secondary prevention, and tertiary prevention through immunizations and lifestyle programs, disease maintenance through medications, referrals. We focus a lot on education. At every office visit, when you come to see one of our primary care providers, We will provide a visit summary that includes quite a bit of education on any diseases that you may have or health habits that can help control some of those chronic diseases. We do a lot of counseling. We help you navigate sometimes a complex healthcare system. Other terms can be used as a gatekeeper. So really the focus of health maintenance is a combination of health promotion and disease prevention that we focus on. So if the need for primary care is so great, then it is critical that we're doing all that we can do to keep our patients safe. To that end, we have taken the following steps to ensure that our patients and their families remain safe while taking care of their health. We strategically stagger visits. We reduce the risk of people arriving and leaving at the same time. You'll notice in our lobbies, chairs are socially distanced. They're at least 6 feet apart. We try to minimize the amount of people that are in a waiting room at a time. We utilize clustered scheduling. We may have all children coming in the morning and elderly folks in the afternoon, or vice versa, to avoid any potential cross-exposure. We use telemedicine or telehealth, which is allowing remote care for people to help reduce their risk of potential exposure. We limit the amount of visitors coming into the primary care practices. We allow one parent per child, one support person if somebody has a disability, or one family member for elders or any of those with memory concerns. We all wear masks. Obviously, I'm not wearing a mask right now, but I'm in an exam room with the door shut by myself so that you can actually see me speaking. Again, we socially distance, we hand wash frequently. We screen everyone prior to entering the building. This includes all patients, all staff, providers. There's a list of COVID screening questions that we utilize, as well as a temperature check. So with 2 options to receiving primary care, in-person and telemedicine, it is important to discuss when coming into the office is vital. One of the key reasons to still come into the primary care office is when you have a chronic illness. We often need to have updated lab work, such as those with diabetes need an A1C to help manage their medication needs. Sometimes there's further testing or vital signs that we need to get. These things often cannot be monitored from the home setting. We focus on preventative services. Vaccinations are so critical right now, including influenza, shingles, pneumonia, tetanus, pertussis, just to name a few. We do wellness visits, physicals. We also, in primary care practices, see children. Children wellness visits and adolescent wellness visits are so critical, especially at a time like now. We need to maintain vaccinations. As Dr. Gilkey said, we're running behind in the state of Maine. We need to get people caught up. We discuss appropriate screenings that may be due at those wellness visits. We see acute illnesses and or new problems. We don't want you to let things build up and turn into a bad outcome. So let's talk a little bit about when to stay home and use telemedicine or telehealth for your health. Follow-up visits to discuss worsening or improved symptoms, to adjust new medications. Behavioral health visits, depression and anxiety, very prevalent with the challenges that we're facing today. Basic acute illness can be done through telemedicine, a cough, sore throat, fever, chills, anything recently started. Patients who are immunocompromised and at high risk, the risk of exposure mitigates the benefits of them coming into the office for the additional testing and labs. Chronic disease education is nicely done through telemedicine to help educate the patient and or family. If you're wondering if a telemedicine visit is right for you, please call and talk with your primary care office. The patient service representative will schedule your telemedicine visit for you. They will send you an email with a Zoom invite with a scheduled date and time of your visit. The day of your telemedicine visit, a medical assistant will call you and help walk you through a telemedicine visit. One last piece of advice, if I can offer you anything, hear me now. Please call your primary care practice, talk to your family, friends, coworkers. Your health and wellness is so important during this pandemic. Reach out to your primary care, see if you need a checkup and an appointment. We are here for you and we're ready to help keep you healthy. Thank you for your time today.
Thanks, Emily. Boy, that's such an important message. not to lose sight of primary care during our COVID pandemic. Next is Dr. Sheena Whitaker. It's a pleasure having you join us. Another aspect of primary care is pediatrics. Much of what your team does is to provide preventive care. Help us understand the importance of keeping up with prevention. Sheena?
Thank you, Ed. I agree with Emily that it's now more important than ever. There's so many stressors right now with COVID over the past 6 months, and we don't want to be adding pediatric illness or injury or chronic illnesses to those stressors for the children, but also for the parents and your employees. As Emily stated, there are many reasons for medical visits. It's very similar for children and adults. We certainly see them when they're sick. So we'll see them if they have fever, respiratory distress, dehydration, lethargy. We also see them for acute visits. So they might have belly pain, injury, headaches, depression. One of the best things we do for prevention is our well child checks or checkups. This is something every step of this visit is for prevention. So we look at growth, we ask about nutrition and exercise and sleeping habits. We're on the lookout for obesity, malnutrition, and short stature. We can help intervene and improve development, learning, and behavioral issues so they don't worsen over time. Certainly, we review safety. Car seats and helmets are obvious to prevent injury. Mental health, right now, a lot of children and their parents have situational depression and anxiety with COVID and any other stressors that are happening in their life. And one of the most important, maybe preventative issues that we do in well child checks is developing a relationship with our patients. So we see them from the time they're born. We develop trust with them, some fun maybe. So when they do come to us for sick visits or acute visits, they trust us and can relax with us, and we can give them better care. And of course, vaccines. Emily mentioned vaccines as well, and so will Matt. Vaccines are a huge preventative measure for children and adults. Children do not always like vaccines, of course, but I always tell them I'm so happy when they get a vaccine. So this picture of this child is not what I usually see. I tell them how happy I am because it's much better for me to give them a quick pinch than it would be for me to try to help them with some of these serious illnesses. And we can't cure things like polio and tetanus. I often explain to them that each virus or bacteria is unique, like cars, if you will. Vaccines are the same. So because I'm a pediatrician, I take care of children. There are lots of cartoons in my talk. But think of each virus or bacteria as unique as a car. So you might have the Ford simple car. You could become ill with that and produce antibodies, or you could get the vaccine for that Ford and produce antibodies. So the next time you're exposed to a Ford, you have antibodies and you can fight that off and not become ill. And then there might be other types, such as a Corvette. So again, you could become ill with the Corvette bacteria and produce antibodies, but you're also ill. Or you could get the vaccine, quick pinch, get the vaccine, you have the antibodies, and the next time you're exposed, you will not become ill. Matt will be talking in a little bit about vaccines for adults and some of the resources out there, but I wanted to be sure everybody's aware that the state of Maine provides vaccines free of charge to all children in the state. So if insurance doesn't cover it completely, if they have incomplete insurance or no insurance, children can get their vaccines for free other than a $20 or $30 administrative fee. So please let your parents and children know this. At our visits, of course, we're talking about children and COVID. They are not as likely to get ill with COVID, although they make up 22% of the population. As of a week ago when I made this slide, 7% of children had COVID. Now it's up to about 10%. They don't get it as often, but certainly they do become ill with COVID and they can spread the disease. And we know now with them being at school, that's probably the jump from the 7 to 10%. Being at school, they are good spreaders of disease. They get the same symptoms as adults, very flu-like. It could be fever, runny nose or cough, fatigue, headache, muscle aches, nausea, vomiting, diarrhea, sore throat. And so this is a lot of different symptoms, and thus the importance of them coming to see us. We worry most in children about respiratory distress and dehydration, but generally children do very well, and mostly they can be cared for at home by their parents. This is also a graphic which basically says what I just said, but I wanted to share some graphics with you that you could print from this talk, or you could go to the websites themselves and get some graphics or information that you could share with your employees and staff. We also talked to children and parents about COVID and what could they do to help prevent the spread. This is a nice graphic as well that you could share with people. In the middle there, it talks about children washing their hands. I wanted to talk about masks because a lot of parents feel that or worry that their children are not able to wear masks. But really, there are very few exceptions for children who cannot wear masks. All children over 2 years of age can wear a mask. The mask should fit appropriately. Their faces and noses are smaller. You want it to fit well so that it prevents the spread of disease, but also so that they're comfortable and they're more likely to wear it. Although people worry about their children wearing masks, even children with asthma, developmental delays, autism, sensory disorder, speech issues, they can still wear masks. The only children who should not wear masks are those that cannot take it off themselves. So if they are paralyzed or have cerebral palsy, for instance, or if they're asleep unconscious, then they should not have a mask on. Otherwise, children do acclimate to wearing the mask and they can go to school and then parents can go to work. I know a lot of my children, my patients now, I'll ask them to pull the mask down so that I can look in their mouth. And when I'm done, they immediately pull it back up. I don't need to ask them again. It's becoming somewhat instinctive for them. But despite all these efforts of prevention for COVID and illnesses in general, there are times that the children are going to become ill. We talk to parents about calling us at any time if they're not sure what to do with an ill child. This is a graphic that talks about when to seek out care and when they can stay at home. Fever is something they should call us for, severe sore throat, a cough that does not improve, although they can return back to school if their cough is returning or improving. Vomiting, diarrhea, they should stay home. And they should seek us out not only to help their child improve or to see if they need to be hospitalized, but also we sometimes say, oh, they can go back to school, and then the parents can go back to work. So we are here to help them make those decisions. We've also been talking to parents a lot over the last 6 months about how to cope with COVID. They are really in a no-win situation. They're trying to work, they're trying to teach their children, and this can be amazingly difficult. Socioeconomics is huge, so there are some families that can afford to have a parent stay at home and juggle this. Some can afford tutors or other supports, but many families cannot. Parents are torn. If they send their kids to school, they risk them getting ill. But if they don't, they risk losing their jobs or money, losing their minds, their patience. They're really trying, but this is hard. Many lack the proper skills to teach, and many kids need the special services that school can supply. So we're helping parents and children navigate this to figure out who should go to school, who shouldn't, and how to cope with all of this. And finally, one of the best preventions, I think, is really building resiliency in all of us. It's been shown that just having one adult who believes in a child can help that child become resilient and deal with the stressors of life. But I think we have to do that for each other as well. So we as providers are helping to empower adults, parents. They can in turn empower their children. And hopefully employers are also working with their employees, supporting them. And Angela will be talking about this as well. You know, how do we support them so that they're able to give their all at work, but also support their children and really bounce back after this COVID experience that we're all going through, and really all experiences in life. Thank you.
Thanks, Sheena. You know, I relate to the resiliency of Tigger there, and my intent is to bounce right through all of this. Next up is Matt Marston. Thank you for joining us. Help us to think about vaccinations during the pandemic and tune us into the flu vaccination program now underway. Matt?
Thank you, Ed, and thank you to all of you that have joined us here today to talk about prevention and the care of our employees. So as Sheena and Emily have mentioned, vaccines are of critical importance for the health of our community. And we have many years of data demonstrating both their safety and effectiveness at preventing illness. Influenza vaccines reduce risk of urgent or unscheduled provider visits by as much as 40 to 60%. And they reduce the risk of flu-related hospitalizations by another 40%. and the risk of flu-related intensive care unit stays by 82%. So what this means for us is that we have a tool at our disposal to make sure that both ourselves and our employees can stay healthy for as long as possible and avoid unnecessary risk in terms of becoming ill with flu-related illnesses. And of this year, it's of even more importance given the presence of COVID-19. And while we can't prevent COVID-19 with vaccinations yet, we can prevent the flu. And one of the problems that we face this year with the upcoming flu season is that you can get flu-related illness and have that present very similar to COVID-19. And determining whether someone has COVID-19 or the flu can be of particular concern for us as employers as well as our employees. So as employers, we have a vested interest in the health and wellness of our employees. And your participation in this event highlights this commitment. So one tool at our disposal for prevention is vaccination. And we offer at Northern Light Pharmacy, for example, an employer-sponsored vaccination clinic. And the benefits of doing this is reducing employee sick time, making sure that employees stay healthy and avoid flu-related illnesses, decrease costs to employee health plans and the expenses related to that, as well as an added convenience for our employees. So it's very difficult for employees and ourselves to manage time, both in and outside of work. And then bringing these vaccines directly to our employees can make it so both our vaccination rates are increased, as well as increased productivity both in and out of work, and not having to leave to go schedule an appointment or make an unscheduled trip to a pharmacy just to receive a vaccine. Ultimately, healthier employees improves morale as well. I think we all know how an illness can affect us both in and outside of work. And one step that we can take to avoid that is through vaccination. So this year for COVID-19, we've worked with our infection prevention teams, and we've really developed some robust processes to make sure that we can vaccinate our own employees across Northern Light Health, as well as those in the community, in a safe fashion for both the vaccinator and the employees that we're vaccinating. So some ways that we're doing that is just like in our Northern Light facilities, universal masking is of key importance. So both our vaccinators and those that we will be vaccinating are required to wear masks for the protection of all. Our vaccinators, as we have to get them within 6 feet to provide the vaccines, will be wearing eye protection, either in the forms of goggles or face shields. And we frequently sanitize all of the equipment that we use, including the chairs, the pens, the clipboards that people will be interacting with to document that vaccination's taken place. We also maintain 6-foot distancing during the duration of the clinic, where employees will queue up in line, as well as between chairs in which employees are vaccinated. So as in prior years, Northern Light Pharmacy is delighted to continue to offer employer-sponsored vaccination clinics as a solution for the community. And if you don't have a clinic scheduled already for your employees, I would encourage you to reach out, and I'm happy to provide additional information on what these clinics look like, how they operate, and provide that service to your employees. So we have a great deal of experience in administering this type of service. Our pharmacists administer more than 5,000 vaccinations every year. We offer the convenience of bringing that service direct to your employees, with the capability of both doing roster billing or insurance billing, depending on how your employer health plan is set up. We have our infection prevention approved procedures to make sure that safety is maintained for all during the clinics that we offer. And it's given at an affordable rate of $31 per vaccine, which is the same rate that you would receive at most pharmacies if you just walk through the door. So this service is provided at the same fee that we offer just in our pharmacies in general. So thank you all again for your commitment to the health of your employees, and I sincerely hope to hear from many of you that are interested in learning more.
Thanks, Matt. Next up is Angela Felicia. We appreciate you joining us once again, Angela. Everyone is so over COVID, but COVID is not yet done with us. The stress is mounting. Help us to understand some of the resources to assist our employees. Angela?
Thank you, Ed. And boy, that is true, isn't it? Aren't we all sort of over COVID? But you're right, we're heading into post-Labor Day weekend. So hopefully people were safe over the holiday weekend and we won't end up having a big increase in cases. As many of my colleagues have already talked about on the call here, just setting the stage in terms of the variety of stressors we've experienced together as a country, really, and really as a world for some of these in terms of the pandemic, the health and safety concerns, financial challenges, businesses closing or reducing capacity. And then, of course, layering on top of that, there's been some civil unrest, political discord. So those are all from the stressors. I think in terms of mental wellness, the other thing to really think about too is there's this grief and loss component that isn't always discussed. But it's been a ton of losses associated with this pandemic and some of these other challenges. You know, vacations have been canceled, graduations. My husband's a school teacher, so his high school seniors, you know, they had a really different kind of graduation this year than what they've ever had. It's been really challenging. So lots and lots of grief and loss in addition to these stressors. The next slide, Lainey. So with all of those, grief and loss, stressors can certainly come with individual pain, discomfort, challenges associated with stress. But those individual challenges can then lead to workplace costs and workplace challenges. You know, certainly if you're not getting good sleep because you're stressed, you're anxious, etc., you're going to potentially come to work late. Maybe your work isn't going to be as good as it usually is. If you're unable to concentrate because you're worried about, gosh, how am I going to homeschool my kiddos? That's going to mean that you're a little bit absent-minded at work and perhaps not performing up to your best, and might even increase some of those work-related accidents as maybe people aren't paying as close attention as usual. Some of the other things that really associated with stress that we don't always think about is that irritability, frustration, anger. You know, when we're stressed, those emotions tend to increase. So as those emotions increase, sometimes we take those out on the nearest person to us, and that could be a coworker, a boss, even a customer. So all of those individual challenges can really have an impact in the workplace as well. So we want to provide you all with some real life ways, tips, examples of how we might be able to help individually ourselves, but then also our employees in regards to our mental wellness. You know, one of the things that I worked with a psychiatrist who's also a friend of mine for a number of years, and he always said that the head really is connected to the body. So I've sort of adapted that mantra for myself. You know, oftentimes we might disconnect the head from the body and think as if mental wellness, mental health was somehow separate. But these things are really intricately connected. You know, when we're consuming high quality food, you know, we're not necessarily eating every meal of donuts and ice cream. When we typically feel better physically, and we typically feel better emotionally. Exercise has been shown to be a really great way to increase your physical health, but then also to increase your mental wellness as well. Sleep, I can't say enough about sleep. One of the things that I have done in my role as a therapist through the years is to always ask people about sleep. Tell me about your sleep. How are you? How many hours are you getting? Are there any challenges? Everything is harder if we're not sleeping. So really focusing on sleep as self-care can be extremely helpful. Substance use is definitely something to keep in mind and think about as we're stressed. You know, I've seen a lot of memes on social media and kind of funny jokes about, you know, gosh, I'm pouring Bailey's in my coffee now, or is there now any bad time to drink wine? And while those jokes and memes can be funny, it can actually make anxiety, depression, stress much, much worse. And believe it or not, even though that nightcap you think is helping you sleep, in fact, it's causing poor quality sleep, and is not, in fact, that helpful. That social well-being also is really, really important. So of course, that's been a huge challenge for all of us in the context of this pandemic, as we've all had to socially isolate, physically isolate, or physically distance from others. So we're not able to engage in some of those social interactions. Having Zoom interactions, FaceTime interactions, whatever the platform is, that can be really helpful. Phone calls, etc. We live in Maine. We're very lucky here that we've got access to the outdoors. It might be that you and your friends can go take a walk, or even while the weather remains nice, sit outside and get some physically distant connection with neighbors and friends. So in thinking about mental wellness and thinking about employers, one of the things that we here at Northern Light talk about is having a culture of caring, where we not only want to provide care for our patients, but we also want to provide care for each other as colleagues and coworkers. So there are some organizational strategies that employers can really utilize to create your own culture of caring. One of the things that I've actually chatted with some of my coworkers, I've been working from home since March, and I have a lot of coworkers who've been working from home as long, is that initially we all felt like, oh my gosh, we can't leave our desk, I can't leave my computer. I really need to be kind of hunkered down and focused on my work. Obviously, I need to be focused on my work, but we do need to take some of those breaks. It's unrealistic to think we're going to spend 8, 9, 10 hours a day hunkered down in front of your computer at your desk doing work. We need to take some of those regular breaks. In the same way that we would have done in the live environment, people take breaks during the day. We want to remind folks that oftentimes we're going to leave work on the table to get done the next day, and that's going to be okay. I think one of the challenges too for professionals and workers who are good at their jobs is we often don't want to be perceived as if we're not working hard. So part of that culture of caring is to really let your employees know, like, hey, it is okay to take a break. I want you to actually go have a stretch, come back, get back to work. Modeling that as well. If you're the leader in your organization, sort of modeling actually taking a vacation, taking a proper day off, where on your day off you're not responding to emails, that's going to be very helpful. That goes right along with those regular vacations. This healthy email policy, I think, is really interesting. One of the challenges is that we're connected now 24/7. So it's really possible to send an email if you wake up in the middle of the night, right from your bedside at 3 in the morning. So we want to create a culture where no one's expecting you to reply at 3 a.m. when you wake up in the middle of the night, so that we kind of have a time period where we can shut things down and rest. All of these tips really create self-care, giving ourselves that opportunity to take care of ourselves. And then, of course, model this for others. People will do what their leaders do. So if the leader is responding to emails at midnight, 3 a.m., 5 a.m., that sets the expectation that that's what the employees should be doing as well. Next slide. Thank you. So really big part of mental wellness for our employees, for our workforce, is to actually engage employees and ask them the question. For some folks, flexible scheduling works really well, and that could be something that's helpful. For other folks, that doesn't work for them. That wouldn't be something that would help them. So really being open to asking some of those questions of your employees and seeing what actually would be helpful for those individual employees. Now, certainly we can't meet everyone's demands all the time, but engaging employees in that conversation is really part of that mental wellness, that overall taking care of each other, where we're asking those questions and leaving the door open for folks to be able to communicate with you about what would be helpful to them. Next slide. Thanks, Lainey. So some other strategies that are going to be really important moving forward, and here's again where that mental wellness and physical wellness get connected right away. Making those ergonomics a priority, no matter what your role is in the organization. If you're sitting behind a desk all day, an ergonomic assessment, screening is going to be important. But if you are standing at a cash register all day, that's going to be a whole different kind of ergonomic screening, both of which are important. Oftentimes when we were all going into the workplace, sometimes people would bring in food. Oftentimes the food would be very delicious, but not necessarily nutritious. So we can also plan or sponsor sort of those nutritious, healthy meals or healthy snacks if we're all working together. Recognizing folks for their work. I actually just heard a really interesting podcast over the weekend, and it talked about recognizing folks in a really appropriate way and not necessarily recognizing folks for things that people should do anyway, but kind of recognizing when people do a little above and beyond goes a long way. And it doesn't necessarily have to be a big production. It could just, in fact, be an email that says, hey, I noticed that you did a top-notch job on that project. You went above and beyond. Thanks a lot for that. It can be just that simple. I love this idea of stop doing goals. That's something that I had learned about here at Acadia when I joined Acadia, is that sometimes we do things just because we've always done it, and we might not need to do it anymore. It might not be that efficient. So kind of making some of those goals around things that maybe we don't need to do anymore. Promoting sleep, I just talked about that. If possible, if you're working together and you're not working virtually, if you can have walking meetings, that's excellent. You're getting that physical benefit plus some mental benefit too. So my colleagues also talked about preventative care. One of the things we can really, really do as employers is encourage our employees to utilize their health benefit, to utilize their wellness benefit. Employees getting those preventative visits, whether it's an adult prevention visit or a kiddo prevention visit. One, we're going to have healthier workforce, but two, we're going to save money in the long run, as it's much, much more cost effective for an adult to see Emily get some of those adult vaccines, be taken care of ahead of time before she needs to sort of treat that adult for some major chronic illness. Helping people learn how to manage their stress is going to be really helpful as well. And then mindfulness. So this could just be a 10-minute mindfulness break. It could be something a bit longer. You can have folks come on site to practice mindfulness, but this could be just something as simple as a 10-minute breathing break, a 5-minute breathing break to encourage that mindfulness. And then the last piece, I wanted to leave you all with some phone numbers for follow-up. I'd be happy to talk with people for additional follow-up. My phone number is actually on the slide here for Northern Light Healthy Life Resources. Obviously, your employee assistance program, if you don't have one. Workforce EAP is a great option. Lots of counseling and therapy is being done via telehealth right now, which is also a great option. And then, of course, state national resources for mental health and wellness as well. Thanks, everybody.
Well, thanks, Angela. Actually, that creating stop doing goals reminds me of one of my favorite management sayings, and that is, a good manager knows what to do. A great manager knows what not to do.
Oh, I like that.
Yeah, me too, me too. So next up is Dr. Jarvis, our scientific rock of Gibraltar. Jim, Jim, I personally want to thank you for all the effort you expend to keep us up to date. What's the latest on COVID and testing?
Yeah, so unfortunately, I don't have a lot of new information to say than I have the last few weeks. We continue to be hampered by supply chain issues across the country when it comes to testing, having testing supplies. That includes the swabs that we actually use to collect the specimens, the tubes that they go into, the chemical that's inside that tube, the chemical reagents we use on our analyzers, and even the tips for the pipettes that draw the solution out of those test tubes into our machines is on limited supply. And so that's just causing continued delays, particularly when we're talking about large scale, large volume testing for employers, schools, and the like. That turnaround times continue to be in the average of longer than 3 days. Some people have been fortunate to find large companies that have been able to run their tests a little bit sooner than that, but it continues to be a problem. Here in the state of Maine, we do see some good news on the horizon. The state's second lab is set up, and they feel that they will be able to increase turnaround time for those state standing order tests, and that's good and welcome news, particularly for the travel industry, as we have people that travel into the state being able to get a test done in a timely fashion to see that they are negative, so that they don't have to do the 14-day quarantine. So that's that's good news for us. We continue to keep up with demand for clinical settings, but that's a struggle. So I'm going to change pace a little bit today. One, I just want to talk about in the news that one of the vaccine trials has been placed on hold. There are many companies around the world working on a COVID-19 vaccine in response to this pandemic. One of the leaders in that, working with Oxford University, is AstraZeneca. And they had a severe reaction in one of the people that have been volunteered to be in that the first line of testing of that vaccine. This is not uncommon for vaccine trials and is nothing for us to be overly concerned about, except to state that we are trying to create the safest vaccine possible, and this is one of the processes that we go through. I just wanted to give 5 little quick things that maybe your listeners would be happy to hear about, things that you don't need to do to keep yourself safe. One is you don't need to wear gloves when you're out shopping. We often see this where people wear gloves thinking that that's a good protection for them, but we really know that out in day-to-day activities that gloves really offer very little protection because there's very little chance of picking up the virus on a surface that's out there. And actually, it keeps us from using that hand sanitizer that we think is really necessary to keep the spread of the disease down low. In the same vein, you don't need to disinfect your food, frozen or otherwise. We know that the virus really has not been shown to be spread by foodborne contact, and so when you go to the grocery store, you don't need to worry about that's unsafe. For those of you that are in libraries or concerned about the books, bookkeeping books that get passed along from person to person in your offices. Again, highly unlikely that would pose any kind of threat to us. If you're concerned, quarantining those books for 3 days has been shown to really make it so that they are completely safe. In that same vein, mail is probably safe all the time. So you don't have to worry about those packages being delivered to your office or to your home or your regular mail. Chances are they have been actually out in without being handled by humans for quite some time, and even being outside while you're waiting to pick them up, just the natural environment will kill that virus. And then lastly, having people come in and out of your offices or homes for things like deliveries, repairs, or cleaning. Again, a safe thing to do, but make sure they follow the same rules that you're asking your employees, customers, and staff to do. Wear masks, use hand sanitizers, stay 6 feet apart. And with that, we'll turn it over for questions.
Well, thanks, Jim. And yeah, let's focus on your questions. I will group similar questions together so we can address as many questions as possible. Actually, the first set of questions is for Dr. Whitaker. I have 2 of them. What's the real risk of missing childhood vaccinations? We occasionally read over the last couple of years about measles outbreaks, for instance, but is this something parents need to worry about?
Yes, that's the answer to that. Yeah, and the reason is, many of us have forgotten what those diseases are like, right? So we don't see polio, people limping down the street with polio, and we don't see people with measles, and children aren't dying from measles. So I think people have a disconnect that we no longer need the vaccines. The reason measles and other illnesses are coming back is because not everyone's getting vaccinated, and we need herd immunity. So that's where the majority of people in the population are vaccinated. We need that because even if everybody gets vaccinated, not everybody responds well to the vaccine, and they don't build up enough immunity to protect themselves. So for those few people that the vaccine doesn't work for, we need to protect them and not give them the disease in the first place. So some of the diseases, like I mentioned earlier, are polio, tetanus, which we can't cure at all, and children can die from it. Others happen so quickly, like meningitis. We have antibiotics for it, but the disease is so quick that children could lose literally hands and feet and brain functioning before we can fix it for them. Some illnesses are more mild, like chickenpox, and people say, well, why do we need to vaccinate against that? Well, we've looked at it because it's so widespread and interferes with learning for children in school and parents working. I think it's important that they still can go to school. And we know that children can die from chickenpox if they're immunosuppressed. So we want to protect those children who are immunosuppressed as well. So there's really no downside to vaccines in my mind. I always tell parents that I vaccinate myself and my children. It's just helping me build the antibodies so I'm protected in the future. And now I tell them, I can't wait to give them the COVID vaccine when it comes out, and they just laugh. Here comes one more. So yes, very important for vaccines to happen for children.
Great. Thanks, Sheena. Yeah, I'll add 2 cents to that. I think we've all come to appreciate that the coronavirus that causes COVID-19 disease is highly infective. It transmits very effectively between people. And with that thought in mind, measles is even more transmissible. I mean, so that gives you a further appreciation because we're learning so much about the coronavirus. Let's not forget about some of our other ones. Next question, Emily, give us more of an understanding of the benefit of having a primary care provider.
Sure. So we act as a gatekeeper for all your healthcare needs. We, screen you for different illnesses, diseases, do preventative labs yearly, do your physical, and catch illness before it's really having untoward effects on your body.
Great, thank you. So Matt, is it hard to tell a clinical difference between symptoms of flu and COVID-19? And with that thought in mind, does this impact the importance of getting a flu shot, particularly this year?
Yes, it is of even higher importance to get your flu shot this year due to that confounder of, is it the flu? Is it COVID-19? We don't know. We have to treat all those cases as if it's a possible COVID-19 infection. So getting that flu shot and preventing that flu-related illness could also prevent a visit where you have to be treated like you might potentially have COVID-19, even though it might be the flu. So in that upcoming flu season that we have now upon us, we need to have even more diligence to make sure that we're preventing those diseases that are preventable, such as influenza.
So Matt, one follow-up question for you. I think we're learning some things about vaccination because of this anticipation for the COVID-19 vaccination. They talk about how efficient the flu vaccine might be, and in some years it might be as low as 30%. In a year that it really is very effective, it's usually about 70%, maybe a little bit more. Do you have any information about what's anticipated for this year's flu vaccine in terms of its efficiency?
Yeah, so that efficiency does vary year to year. It's very difficult to know ahead of time how effective the vaccine will be. However, in many of the cases where it's said that a vaccine is not effective, that's also a partial truth, because if you aren't conferring immunity to influenza, there is some evidence to show out there that the severity of illness when you contract influenza is drastically reduced. So even if you don't have a full immunity and prevent the illness, it could prevent a hospitalization or even more detrimental effects to your health by getting that influenza vaccine. So I think that's that's a partial truth that we all need to be aware of that circulates out there and is in a lot of the media. There are still benefits to receiving the vaccine, regardless of what that published efficacy is in total immunity.
So Matt, I hate to do this to you, but we're on a roll here.
Yep.
There's another question that's really pertinent here. So why are flu vaccinations recommended this year when everyone should be wearing a mask anyway?
Yeah, so I know, as Dr. Jarvis has mentioned on quite a few different occasions as well, the masks are really there to help prevent you from spreading illness to others. So it acts as a barrier for the wearer to protect against infecting others around them when they're asymptomatic. However, it is still possible while wearing a mask that if another individual is not wearing one, that you could contract that illness. So by getting that vaccine, that provides that immunity to yourself and your protection to yourself, that you can then protect others around you by not carrying that illness as well. So it really provides protection both for the wearer and for those around you by getting a vaccine versus a mask that's simply providing protection for those around you.
So the bottom line sounds like this year flu vaccine is more important than ever.
Absolutely.
Yeah, okay, well, thanks. Angela, thank you for sharing that large collection of resources. That's really going to prove valuable to everybody. You mentioned grief and loss. Are there stages people go through, like in other losses, that we collectively should be watching for in our employees?
Yeah, that's a great question, actually, and not something that's really been talked about that often in terms of grief and loss in the context of the pandemic and everything that's been going on. Absolutely. The classic researcher on grief and loss was Elizabeth Kubler-Ross, and she really put forth some models in terms of stages of grief. One of the things I think in terms of employers to really look out for is any kind of sort of personality change from your employee. So a really sort of ground level example of that is if you've got an employee who's typically pretty happy-go-lucky, gets along with folks, and then suddenly they can't seem to get along with anybody, they're really cranky, bickering, that sort of thing, that might be a time to sort of check in with that employee. How you doing? I notice things are a little different. Can I get you connected with a resource? So any of those personality changes, or even work performance changes. So, obviously work performance can be just a work performance issue, but if it's kind of sudden and it's from an employee who usually does really good work, maybe there's a grief and loss issue going on for them. They could be pretty overwhelmed. Again, check in. I notice here's this difference in your work. Is everything going okay? Can I connect you with resources?
So Angela, just a quick follow-up. I can envision somebody saying, oh, this is no big deal, just kind of blowing it off. And could that actually be masquerading as a denial, as one of those stages of loss?
Oh, sure, absolutely. And, folks cope with things in a variety of ways. So sometimes we sort of say, no big deal. It's not bothering me at all. And that can absolutely be a denial. It could also be a method of coping that only will work for so long. So when we sort of say, oh, no big deal, but things continue to pile up, it all becomes a big deal. So we want to be able to address those things right away. Absolutely.
Great. Well, thank you. Yeah.
And if I could add in about children,
please.
I think sometimes, children also go through mourning and loss. Yep. And sometimes, they could be crabby or misbehaving. Maybe they're not sleeping as well. And sometimes I think the tendency can be to say, oh, that's a bad kid, or those parents don't know how they're parenting, how to parent, or, we tend to judge children rather than say, hey, what's going on underneath there for that child and that family, and how can we support them? So I think if people are seeing anything in their employees, like Angela's been talking about, also maybe check in what's going on for their children and how are they coping and dealing with all the changes that have happened. Like we mentioned earlier, no 8th grade graduation, a lot of camps were canceled. Children are really struggling with a lot of changes in their life. So to be on the lookout for them as well.
Mm. Sheena, let me ask you a follow-up question that segues very well into this. And you talk about the coping mechanisms about kids, the clues that maybe there's something up with them. Do kids worry about COVID? You know, you think about this information about deaths and occasionally hearing about kids with very severe disease or death. Do kids worry about COVID? And how do I talk to my kids about it?
Right, it's a great question. So, of course, kids worry because they're humans just like us. They often feed off of their parents. So, anxious parents do produce anxious children, and they'll feed off of some of that anxiety. So, I think that could be part of it. We certainly want to talk to them about it. I always talk to children straightforward, whatever they're asking, whether it be COVID or stooling and pooping habits or puberty. I just tell them like it is. They want to know. They take in what they can handle, and the rest probably flows over them if it's too much. But I think it's good to keep it simple. Let them know that parents are figuring it out, adults are figuring it out. It's not for them to figure out. We'll help them with it. And to help them with coping, I agree with Angela. I always talk about good sleep habits and eating well and healthy foods and getting outside every day, not being on the screen. All those things can really fortify children, help them be stronger and cope with these changes that are happening. But yes, I have many children who are very worried. I had a child yesterday say he will not take off his mask when he's on the playground or when they tell him he can. He's keeping his mask on all day long because he feels more comfortable that way. So they are worrying, and we do need to be thinking about them while we're also trying to cope with this ourselves.
Thanks for that. That's very helpful. I'll also point out in the chat room that Dr. Whitaker has shared some longstanding wisdom from Ben Franklin. An ounce of prevention is worth a pound of cure. That's probably the take-home message from today's session, and thanks for that. Dr. Jarvis, I have a couple of questions for you. Why are the rapid tests not available? And then I'll follow that up with talk a little bit about the false negative issue with that testing methodology.
Yeah, so the rapid tests use a different kind of way of doing the analysis beyond what is become the standard of care for COVID testing, which is a PCR or a polymerase chain reaction test. So it really just kind of looks to see if it finds viral particles, very similar kind of to the way we do some other testing in a rapid format. The challenge is a couple of fold. One is that the companies that make the rapid tests have not been able to do mass production. And two, we found that unfortunately, they sometimes miss some asymptomatic individuals who either their viral load isn't high enough initially to make the test turn positive, or there's a problem with the way that the test is run that causes them to have a false negative test. And what that does, that means that people will be out in the community thinking that they don't have the disease, but they really do. And that obviously is problematic because they may let their guard down, not wear that mask, not wash their hands quite as frequently, or other people kind of get it within that 6-foot sphere of them. And then the disease gets spread. And obviously, we've seen several outbreaks recently across the state of Maine where people have let their guard down and asymptomatic individuals have caused other people to become symptomatic. And so that's the problem with those rapid tests. We still really rely on those PCR tests as the end-all be-all for whether somebody's positive or negative.
Well, thanks, Dr. Jarvis. And unfortunately, we're winding down here. Once again, I wish I had another hour to ask the questions of our experts here. Great answers. Thank you, panelists. Tuning into all aspects of health, including prevention, is more critical than ever. Thank you for sharing your insights. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information to keep the people of Maine safe. We hope you have picked up some useful tips to support all those around you. Each of you is a leader, and each of you make a difference in others' lives. Our next session is on September 24th, 2 weeks from today. We will offer you a comprehensive update on all things COVID. Topics are direct suggestions you gave us on our prior surveys. They include cybersecurity and internet safety, latest on testing, screening, and trends, tips about safe travel and working in the field, how to have group meetings when technology isn't an option, The goal is to keep you up to date on the rapidly changing informational environment that enables all of us to do our part in keeping everyone healthy, safe, and working. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you and have a good afternoon.